Good morning, everyone. My name is Lydia Lukomsky, and I'm a second-year student at Eastern Virginia Medical School. As an EVMS Summer Scholar this year, I had the opportunity to contribute to the Portsmouth Diabetes Prevention Project alongside Rohini Pereira, Amy Paulson, Dr. Margaret Baumgarten, and Tiara Langley. I worked specifically on the recruitment of participants for the EVMS Connect for Health Plus Wellness Coaching Study. The aim of this study is to address the need for diabetes prevention and management in the local area. As demonstrated by the graphs to the right, Norfolk and Portsmouth residents suffer from a higher rate of obesity and food insecurity, which contribute to the higher rates of diagnosed diabetes as well. The National Diabetes Prevention Project is a year-long education-based program which is effective at preventing and managing diabetes, but the barriers to the program are quite significant, especially to low-income families. The EVMS Connect for Health Wellness Coaching Program aims to bypass some of those barriers, including cost, time commitment, and lack of childcare or transportation to classes. Our participants are paired with a virtual wellness coach to conduct motivational interviewing, goal setting, and goal revision to improve self-efficacy and create a better lifestyle. This year's program also provided participants with a blood pressure machine and weight scale to monitor their health, which is called the Connect for Health Plus component. Recruitment for Connect for Health Plus was conducted at EVMS Portsmouth Family Medicine and Ghent Family Medicine offices. Requirements for participation are residents in Portsmouth or Norfolk, 18 years of age or more, not pregnant, and ability to speak English. Coaches are recruited through the community and the EVMS student body, then trained with online modules before being paired with 1 to 2 participants. For the first 30 days, coaches work with participants to set and achieve small, measurable goals toward healthy eating or increasing physical activity. From day 31 through 60, in addition to goal setting, the participants record their weight and blood pressure. At the end of 60 days, participants can renew the program for another 30 days or discontinue. Google Voice was used for all communication between coaches and participants. Recruitment has been completed successfully and data collection is still underway. Participants are just now wrapping up the 60-day cycle. More than half of our current participants identify as female. There is equal distribution of Norfolk and Portsmouth residents. Most of our participants identify as Black or African American. Our participants range from 24 to 75 years of age, and the median age is 56. Since the current cohort's data collection is still in progress, I've shown data from previous cycles to give you an idea of what we expect to see in our current study. The average age of the participants in the fall of 2020 was 51, which is close to our current cohort's average age of 55. Of the 164 goals set among the previous 20 participants, 85% of those goals were achieved. The following percentages represent goals completed in full or partial for this cohort. 84% of weight loss goals, 87% of healthy eating goals, 81% of physical activity goals, and 100% of other goals. When looking at success rate over time, fully completed goals increased from 34% in round 1 to 66% by round 3. A goal set in round 3 was 1.6 times more likely to be completed than a goal set in round 1. We saw a decrease in fully completed goals down to 30% in round 4, likely due to the limited number of goals set and the practice effect. Based on this previous data, we expect the current cohort to have similar success rates regardless of the type of goal set. We also predict that participants who choose to continue with more rounds of the program will be more likely to set and achieve goals. We expect retention rates to be higher with the added incentive of a blood pressure cuff and weight scale. With our upcoming data analysis, we hope to design a program suitable for permanent community implementation by the end of this year. Current recommendations based on coach feedback include using a more user-friendly format for data collection to replace REDCap, incentivize coaching, and adding a video conference format to strengthen the coach-participant relationship. With that said, my team and I would like to thank our funders, EVMS Centaura Healthcare Analytics and Delivery Science Institute, and the Portsmouth General Hospital Foundation for making Connect for Health Plus possible. Thank you for listening in, and I look forward to answering any questions.